Hey guys, let's talk about abdominal incisions today. You know, the C-section scar, the laparoscopic surgery scar, all of these things are going to impact, all of these incisions are going to impact your core system, your pressure system. And I've shown this picture before and kind of in the recent past where I talk about this. Thank you, Pelvic Guru, for this image. I use it all the time. Where I talk about all of these muscles here, the diaphragm at the top, pelvic floor at the bottom, the deep abdominals that go all the way around, and this little guy in the back here. They all create a pressure system or seal pressure inside the abdominal space, similar to a soda can. Anytime anything goes on with any of these muscles, it's going to affect the entire team, the whole pressure system. So when it comes to recovering from these, we want to start getting your team back on board as a team. So people often ask me as I do consults for people far and near, what can I start doing immediately after my C-section, immediately after my endometriosis surgery? And I always default back to breathing. Breathing is the activity that is going to get these muscles to coordinate together, or we hope they do. So let's review. When we take a breath in, ideally, as the lungs inflate above, we want everything to shift down. The diaphragm drops down, the pelvic floor should soften, and our belly should soften. As we exhale, things should recoil back up, the belly should draw back in. Now, it's really, really common if we've had an incision in this area to just start kind of gripping it and trying to guard it to protect it very naturally because it hurts. So we want to work through that. And what you can do is you can lay down as probably ideal or recline. You're going to put a hand on your chest and a hand on your belly. And you want to take a breath in through your nose. And you want to imagine that soda can dropping down and your belly expanding. So you're going to think of inhaling and expanding your belly. Exhale, belly should come back in. Notice that I'm taking a breath in through my nose and out through my mouth. And we're trying not to let your chest hand move. So I would do groups of 10, or heck, even put a timer on for a few minutes, 3 to 5 minutes. Focus on nice, lethargic, relaxed breathing. Not trying to do it as big as you can, because those overachievers are going to naturally go and take stiff breaths. So you want to think of lethargic, meandering inhales, and then just gently exhale. Don't imagine that you need to do a certain type or a certain distance. But start doing that in the first couple of weeks after your surgery. And then as you're starting to feel more comfortable, change the position that you're breathing in. Do it laying on your side. It changes gravity as you have to draw back in. And then even progress to going on your hands and knees. As you drop your belly, you have to pull it back up to your spine, and that activates muscles a little bit more. If you have any questions about abdominal incisions, abdominal scars, you can definitely message me. But let's just start breathing. Let's get that core team back together again.